Hi everyone. In today's clip, I will talk a little bit about hot flashes. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. A hot flash is a momentary feeling of intense heat, often along with sweating, flushing, rapid heartbeat, and anxiety caused by sudden changes in hypothalamic thermos regulation. Hot flashes are the core vasomotor symptom or VMS of menopause, but similar episodes can happen from non-menopausal causes. Also, I need to mention that hot flashes can also happen in men, and this can have root causes such as hormonal changes, testicular injury or disease, pituitary or hypothalamic issues, infections such as AIDS, HIV, or even tuberculosis, withdrawal from testosterone replacement therapy and certain medications, as well as just stress and anxiety. So in women, when hot flashes are non-menopausal because of non-menopausal causes, these causes can include medication effects or withdrawals, endocrine conditions like hyperthyroidism or carcinoid flush syndrome. Carcinoid flush syndrome is a condition that is caused by neuroendocrine tumors secreting excess hormones, especially serotonin. This flush appears as a sudden redness and warmth on the face and neck, which can be triggered by stress, alcohol, food, and maybe accompanied by diarrhea or wheezing. Cancer treatments like oophorectomy, which is the removal of one or both ovaries, or adjuvant endocrine therapy, which uses hormone blocking medications, can to reduce the risk of recurrence for women with hormone receptor positive or ER positive breast cancer, and as well as pancreatic tumors or autonomic dysfunction, which is less common, can also cause hot flashes. If hot flashes are new, sudden, or very severe, a medical assessment, including thyroid test or medication review, is absolutely warranted. Now, conventional therapies recommend hormone therapy as the most effective way, and that it be considered, especially within 10 years of menopause or symptomatic women without contraindications. There are also non-hormonal prescription options, including several drugs, and are specially made for people who cannot take estrogen. If uterus is removed, estrogen alone can be used unless ovaries are retained, at which point natural hormone status is going to vary. If ovaries are removed at younger ages, systemic hormone therapy is often recommended until approximate natural menopause age to prevent the side effects of abrupt estrogen loss. It's important to note, for people with current or recent estrogen receptor positive breast cancer, systemic estrogen therapy is generally avoided because it can stimulate tumor growth. Now, non-drug therapies which are helpful and low risk include cognitive behavioral therapy or CBT, which is shown to reduce the severity of hot flashes and improves sleep and quality of life. I mean, it doesn't eliminate the hot flashes, but reduces the distress. Good option for all patients, and especially for those who can't or don't want to use drugs. Then there's lifestyle changes, which include cool sleeping environment, layered clothing, avoiding triggers like hot beverages, alcohol, spicy food, caffeine, or smoking, using portable fans, weight loss if the person is overweight. These are all most modest benefits, but helpful. On the vitamin, supplement, and herbal sides, we have vitamin E complex, which causes modest reduction in hot flash frequency. There is black cohosh. This is a plant traditionally used for menopausal symptoms, including hot flashes, night sweats, vaginal dryness, and mood changes. There's soy isoflavones. These are plant-based compounds found abundantly in soybeans, but they do have estrogen-like properties, as well as red clover. However, these are not good for hormone-sensitive conditions such as breast, uterine, and ovarian cancers, and as well as endometriosis or uterine fibroids. Red clover pretty much acts like estrogen, basically. During natural menopause, where the ovaries gradually reduce hormone production, symptoms often develop much slower. In surgical menopause, the drop in estrogen can be abrupt, and symptoms, of course, are going to be much more severe. Whether you have a uterus or not is going to play what forms of hormone therapy is considered safe. On the vitamin side, we have vitamin E as an antioxidant, which helps with mild reduction in hot flashes, frequency, and severity. We have vitamin D3 and K2 and calcium, because postmenopausal estrogen decline raises bone loss risk, and adequate levels help overall health. These are more for the skeletal health than hot flashes, basically. Then we have phytoestrogens, which is plant estrogens such as soy isoflavones, red clover, flax, etc. And they have estrogen-like actions. We have black cohosh, which is a traditional herbal remedy thought to act on neurotransmitters or estrogenic pathways and provides benefits. But again, not if you have had estrogen receptor positive cancer. Other supplements like evening primrose oil, dong quai, ginseng, sage, maca offer various antioxidant, hormonal modulating, and anti-inflammatory properties. So for all menopausal women, they might want to consider ensuring adequate selenium, vitamin D3 and K2 around like 1,000 to 2,000 international units a day, and calcium around 1,000 milligrams a day. And for those with no contraindications, vitamin E complex and black cohosh. While medical science sees hot flashes primarily as a result of hormonal fluctuation, metaphysical and emotional components are also quite important. Hot flashes are often described metaphysically as fire rising within. They represent the release of suppressed emotions, passion, or power that has been contained or denied for a very long time. Now it is seeking sort of expression and purification through heat. Then it represents rebirth and transformation. Menopause marks a major life passage. The body literally burns away the old reproductive identity to clear space for a new phase of spiritual wisdom and inner power. The fire represents spiritual alchemy, turning old energy into new awareness. Unexpressed emotions, particularly anger, resentment, or frustration, can build as inner heat. Hot flashes may symbolize the need to acknowledge and release the fire safely rather than suppressing it. Hot flashes often appear suddenly and uncontrollably, mirroring how we feel about change itself, especially changes in aging, femininity, sexuality, and identity. Resistance to change or aging can be a factor, letting you know that it's time to release the old self-image and embrace your evolving wisdom. When emotional heat rises through the chest and face, it can sort of reflect emotional release through the heat center, especially grief, sadness, or longing that has been buried. Hope this has been helpful. Like and follow for more. Be the light.